I yield back, Mr. Chair.
Thank you, Mr. Pappas. Ms. Mace, you have 5 minutes.
Thank you, Chairman Takano and Ranking Member Bost. And Mr. Chairman, I want to thank you for your leadership on the PACT Act on this issue, for our men and women in uniform who are literally willing to take a bullet for our country. Our ability to serve them in this capacity via this bill is enormous and will have a tremendous impact on our veterans for the rest of their lives. It was a monumental piece of legislation providing long overdue protections and benefits. I want to thank those who are here today also for how hard you are working to provide for the challenges that our veterans are also facing. We're all trying, our goal is the same at the end of the day, and we're trying to work together and row in the same boat together. My first question this morning is for Mr. Jacobs. The VA intends to use the Toxic Exposure Fund to hire an additional 1,900 employees in fiscal year 2023 to help the influx and process the influx of claims that are going to be due to the PACT Act. And due to the unique nature of life as a service member, there are generations of veterans who found it difficult to transition back into the workforce, as many of you know. In fact, I had a classmate of mine from the Citadel recently up here transitioning out and moving into my district next year, and listening to the challenges that that individual faces. But they're not alone. There are thousands of veterans that are facing those transition challenges. And while the VA and its partners, y'all are doing a tremendous job to help with that transition. But veteran unemployment is still an issue and something that we're all trying to address. In fact, there are over 220,000 unemployed veterans nationwide. To build on this efforts, I introduced the Warrior Training Advancement Course, WARTAC Improvement Act, with Representative Buddy Carter out of Georgia, to improve the WARTAC program, which trains and hires veterans to become claims processors. So my first question is, what are your plans, if any, to recruit more veterans for some of these positions potentially? I think there's a lot of value and meaning to getting veterans in some of those roles.
Congresswoman, thank you very much for that question, and thanks for your advocacy. I think the WARTAC program is fantastic. It's a great resource for us to find transitioning service members who can be dedicated to the mission and help train them for a career in VBA, for a mission-oriented vocation that is going to help them give back to their fellow service members and veterans. We are actively recruiting veterans. We're also recruiting military spouses, and one of the ways that we're mindful of the transition and the constant relocation that's required, so trying to adjust our virtual requirements to enable military spouses to work as they move with their husband or wife. And we're looking to do that. We've had hiring fairs recently in Fort Campbell that were quite successful, and we're looking to replicate that more broadly. I also think that as we educate a lot of veterans who are using their GI Bill, and that's another opportunity as they're considering the many career options that they have in front of them, to let them know that a VA is a potential option, whether it's coming for benefits world or perhaps in the healthcare world and pursuing other training opportunities. I don't think we can do enough here. We're actually moving in the beginning of the year to do a national hiring event. And so part of that effort, as we're working to ramp up, is going to be focused on transitioning service members.
And is there a quota or a goal percentage for those jobs? What percentage you'd want veterans to hold those positions?
No, but what I would tell you is almost 60% of our workforce are veterans. Many more are military spouses, and all of them are veteran advocates who come to work trying to do the right thing.
All right, my next question, I've got about a minute left, Dr. Elna Hall. The Low Country, South Carolina's first congressional district, we're home to about 1/3 of all the veterans in the state of South Carolina, approximately 70,000 individuals, many of whom use the Ralph H. Johnson VA Medical Center. Unfortunately, due to the rising cost of living in Charleston, South Carolina, retaining the talent and high level of employees that we have there has proved to be very difficult to provide for quality care for our veterans. So how are you going to use the new hiring authorities within the PACT Act or elsewhere to make VA jobs potentially more attractive, more retainable, sustainable for high quality folks to serve this community?
Thank you, Congresswoman. As I mentioned before, hiring enough employees to implement this legislation and also to better serve the existing veteran cohort we serve today, including in South Carolina, absolutely depends on hiring faster and more competitively. And we are grateful for the new authorities that we have that allow for better recruitment and retention incentives, the ability to give lump sums up front, the ability to make the hiring process itself more efficient. And I'll ask Ms. Therrett to summarize some of those exciting opportunities. I will say that I am holding myself personally accountable for consistent implementation of all of those authorities across all of our networks in VHA. Ms. Therrett?
Thank you, Dr. Elnahal. I am leading the integrated project team that is implementing Title IX of the PACT Act. We meet on a weekly basis. We are within the fifth wave of 6 waves of completing implementation. The first wave, which we implemented within 30 days of enactment, was removing the restrictions on hiring housekeeping aides. We understand how critical that position is to having our medical centers function effectively. And since doing that, we have seen a 3.2% increase in onboard rates for housekeeping aides. The second effort is to reach that early career talent by using the expedited hiring authorities for college graduates and post-secondary students. VBA, research, contracting have been using those authorities and raising the student loan repayment limits. Our social workers, our human resources professionals, our medical support assistants are actively using those tools that we've put in place since the PACT Act was enacted. The third area that we're focusing on is retention. Right now is that time of year when we are recognizing our high performers. And thankfully, you have removed the statutory caps that we had on awards and bonuses, so we can really recognize and retain our amazing employees throughout the nation. And we have also increased our ability to recognize them through special contribution awards up to $25,000. So all of those authorities have been amazing. We are now in the hardest tranche of our implementation of Title IX, which is focusing on things like critical skills incentives, critical pay positions, special salary rates, pay waiver authority, and the 3 Rs that Dr. Elnahal has mentioned. But we are absolutely across the entire department using every authority in Title IX, trying to get the policies, the systems, the procedures, the training out as soon as possible, because we know the desperate need in the field, and we want to meet that need to serve veterans.
Thank you, Ms. Therrett. I'm just going to add 1 second, Mr. Chairman. In Charleston, South Carolina, it's so expensive to live. A 3-bedroom apartment will cost you $5,000 month to month. It's so important that we retain great employees. Thank you, Mr. Chairman, and I yield back.
Thank you, Ms. Mace. I now recognize Mr. Mervan for 5 minutes.
Thank you, Mr. Chairman. I, of course, want to thank the chairman and the ranking member for their bipartisan approach to be able to pass the PACT Act and your work in doing the implementation and the emphasizing of how important it is to our veterans. What I want to talk about today, Dr. Elnahal, you had mentioned, are the veterans at the center of what we do is the first question. I want to address talk time, and I'd like an administrative definition of what talk time means. And that question would be for Mr. Jacobs and Mr. Bursler. It has come to my attention that the VBA for the National Call Centers has imposed performance standards called talk time, which measures the amount of time legal administrative specialists are on the phone to answer veterans' questions. While this measure is averaged out, it doesn't make expectations. It doesn't make exceptions for calls that may require special attention, including first notice of death calls, if an older veteran has difficulty communicating, or if a veteran has complex or several questions. If an LAS fails this metrics, which can be as little as 8 minutes and 30 seconds, the LAS can be disciplined, which can potentially lead to their termination. This focus on call time decentivizes LASs from asking follow-up questions to veterans or mentioning other benefits and programs the veteran may be eligible for, and for the fear of the call going too long. My question is, I had a experience with this as a township trustee where the first point of contact is the VA. If we're limiting the amount of time to be able to connect with that veteran, we will create future challenges. And so ultimately what I'm asking is, if the reputation and the outcomes and connecting with the veteran is so vitally important with first point of contact, why are we limiting the amount of time for those individuals to be inducted into world-class health care?
Congressman, thank you very much for that question. I agree that veteran experience is critical. It's why for the first time ever, we're going to start measuring veteran experience as part of the disability compensation process. We actively do it in many of our healthcare domains. We haven't done it for disability compensation. We measure success based on timeliness and quality, but I think veteran experience is equally important. And to your point, it's a determining factor as to whether or not a veteran wants to continue to pursue the benefits he or she may have earned, or to follow up and enroll and pursue VA health care. Because
How do you define talk time administratively?
so the talk time is about 8 minutes, is my understanding. I need to follow up and get you